What's new is that we had some interesting first time ever data in patients with diabetes and peripheral arterial disease or intermittent claudication that shows a drug dosed once a week for 1 year improved walking distance significantly and also improved quality of life significantly. And at the end of 12 months, the curves were still separated. The benefit was getting more and more as we went on. So the drug is semaglutide, which is either Ozempic or Wegovy. And we know that the only other drugs that have ever been shown to be beneficial at all are silostazol and pentoxifylline, and they tend to plateau, and it doesn't appear to be as beneficial as what we've seen with semaglutide. So there may be another expanding indication for this class of drugs, the GLP-1 agonist, because it appears that it's even going to be better. They're getting ready to commence additional studies in patients without diabetes. This trial is called the STRIDE trial, was published in Lancet online the day it was presented at the American College of Cardiology this past weekend, the end of March, and it's going to be interesting to see what happens. So we've got new indications for obstructive sleep apnea with these drugs. We have data that they may reduce the risk of drug dependence. They may help us quit smoking. They may help us quit drinking. All those things are in the process. We have data that they appear to help MASLD, or what we used to call non-alcoholic steatohepatitis or non-alcoholic fatty liver disease. There's good data there. That's off-label still, but all these things are coming with this one class of drug that appears to be magic. I don't know what's going on, but there's a lot of it there, and a lot of it probably relates to the weight loss. Obesity is a huge problem causing multiple diseases and exacerbating many others, and these drugs have the best data for weight loss. So the two that are being studied most often right now are semaglutide and also tirzepatide, which is the GLP-1 and GIP receptor agonist. So that one is also Mounjaro or Zepbound. So that's where the studies are going right now, and it really looks very, very promising.